Welcome to the Medical Collective, your go-to podcast where medicine meets real life. I'm Dr. Keisha Davis, a pathologist, personal trainer, and your host. I will be joined by a vibrant team of doctors who are not just healthcare professionals, but artists, fitness enthusiasts, and advocates for change. Each episode, we dive deep into the world of medicine, from untold stories of the healthcare industry to the latest in medical advancements. We're here to bring your insights, answer your burning questions, and explore the art and science of healing. So let's get started and step into the world of the Medical Collective. Hello, everybody. Welcome to another episode of the Medical Collective. And this is a solo episode with your host, Dr. Keisha Davis. I'm glad to be here on a week. It's my week off. I get to chill, relax, and conversate with you. Okay. This episode, I'm going to be very frank with you. You're going to see the raw side of Dr. Keisha as we speak about a topic I think is so important. And it's really about credentials. Everyone's a doctor. Are they really? What are your credentials? How do you sort a title? And when do you spot and how do you spot a fake, right? So important. So we're going to get in that today. You may have seen online lately, Dr. B, let's say Dr. B is selling herbs. Dr. B will cure your thing. Dr. B will give you a free consultation online. Those should all be red flags. I myself have been scrolling through nosily online with my friends who are also physicians, and we share with each other. We're like, this doesn't sound right. This person's not a doctor. And we'll see like thousands of people on there, and they are drawn to the title, and then they are listening and really buying into what the person's saying. And sometimes what's scary is it's not correct information. So we're going to talk about that. First and foremost, what is a doctor? I want to break down these degrees. Now, I have a medical doctor. I've shared that with you all. It's MD. And to practice medicine in the United States, you can go by it two ways. You can get a MD, which is a medical doctorate, or you can get a DO, which is a doctor of osteopathy. Both of those schools are 4 years after you do your college training. For me, I finished my undergrad in 3 years. Some people do 4, some people do more. Now, there are a few programs in the United States where you can do a combined, where you do your undergraduate and MD all in one program, but they are far and few between. So if you go the DO route, that's the osteopathic route. The medical school, the MD route, is the allopathic route. Both of those will allow you to become a medical doctor, to go specialize in a residency, which can be 3 to 7 years. For me, it was 5 years and a fellowship, and be able to practice medicine, be a surgeon, be whatever you want, whether you go either route. So I want you to know those are the practicing medical physicians. When you go and you have a cold, when you need surgery, when you have an issue, when you have a biopsy done, when you have radiology, that's all done by either a doctor that's a MD or a doctor of osteopathy. Okay? So that part should make sense. We practice evidence-based medicine. That means that everything that we do has been shown through research, and not the research that somebody tells you to go do online, right? There's a lot of people saying, go do your research. And I have to catch myself, because I'm like, some people don't even know how to do research. So we can't tell people to go do your research. This is evidence-based research that is done for the practice. So that's why the medicines that are given, the guidance that is given is based on evidence. It was standardized actually in the early 1900s. There was a Flexner report, and this shut down low quality medical schools. So those that weren't practicing based on that, and it formalized medical training. And I think that's important, right? We have to have formalized, especially when we're treating on a patient, when we're dealing with legal aspects, all of that, it needs to be formalized. So that's when it got formalized here, okay? The doctor of osteopathy has the same number of years as us. They have a different approach, but I think that the MD program is getting towards, in some aspects, what the osteopathy is. The whole person is focused on holistic aspect, additional training, and manipulative treatment, which is OMT as well. It did happen in 1874 by Dr. Andrew Still. And Dr. Andrew Still believed traditional medicine was focused on too much medication and surgery. But nearly practice rights are the same for both of them in the United States. They prescribe medicine, as I mentioned before, and do surgery in all specialties, okay? So those are the doctors that we speak about on the show. Now, we have to give credit to many other type of doctors that actually do have credentials, and that's the PhD. So when someone says they have a doctorate, it's okay to ask, what type of doctor are you, or where did you get your training from? And the PhD is a doctor of philosophy. Now, many of those, actually, when I was in my residency training for pathology, the microbiologist had a PhD. So she wasn't an MD, she had a PhD in microbiology, and she was over the lab, and we addressed her as doctor. They have advanced research doctorates. This requires original research and dissertation. So they know how to do their research. The use of doctor is really correctly used in an academic research context. This is where the confusion arises in clinical or health settings. When a patient assumes that a PhD may be in nutrition, a PhD in psychology, etc., are physicians. And it matters because it's important, I feel, to distinguish between a clinical doctorate and an academic doctorate in public communication. And the reason I've seen this, and I've actually seen this on social media, where there is a doctor and he's, say, a doctor of microbiology or genetics, and then they cross into the realm, especially there's been a lot going on, right? We just got out of the pandemic. There's a lot of confusion around healthcare and how it's being put in the media. And so some doctors go on there that when they present themselves as doctor, people think, oh, they start asking medical questions. First of all, anything online is for information and educational purposes, as well as this podcast. It should not be used for you to guide for treatment, right? That's a patient-doctor relationship, and that's not done on a social media basis. But this doctor was kind of blurring the lines when they started to talk about things that were outside of their scope of practice, right? If you get a PhD in microbiology, your expertise is in such. And when you're leading, right, you're leading. Now, we can talk about anything we want, right, as a human being, but what you're leading with your credentials, you got to make sure that you don't obscure it. I'm going to tell you later, I've seen some people that have PhDs and then they put health and science on there, even though their PhD may be in education, so that they can be or lead these conversations on science and health that are not in their expertise at all. Okay, that is the PhD. Now, in this realm of doctorates, right? After we get through the PhD is a PharmD, or a doctorate of pharmacy. That's another example of someone that has a doctorate. A doctorate of pharmacy, a doctorate of nursing, a doctorate of physical therapy. Now, I think these are real doctoral level trainings, but what happens is there's confusion when it's without context. I actually went to an urgent care one time, and I'm a physician, and they were like, the doctor will see you. You've got to be clear. It was actually first a nurse practitioner, to be honest. She was going through her doctorate, but did not receive it, and she was presenting as the doctor over the practice, and she's not. Even when they get their doctorate, they are not a doctor of medicine. And I want to explain the difference to you. You just understood that there's a doctor of philosophy, right? So they have a doctorate in their training. When you do a doctorate in nursing, I just told you the 4 years of medical school. I told you the 3 to 7 years of residency, and then some even do fellowship. The nursing has a totally different training. They don't go to medical school. Their training is to be as a nurse. And then when they get their doctorate, that is more of an academic doctorate. It's a lot of didactics and sitting. It's not practicing as a resident would. Residents are on the hospital floors for 3 to 7 years, taking care of patients, and that's all they're doing to get their specialty training after their medical doctorate, which is different. But it does get confusing, and I've seen several doctors that are nurses leading as if they're a medical doctor in their way of speaking and guiding conversation. And that, to me, is where it's problematic. Having a doctorate is not, but trying to take your doctorate over to another field is a problem. Okay, that's the doctorate of nursing. The doctorate of pharmacy, I don't think people get that confused. There's a lot of pharmacists and they say, I'm a pharmacist or, doctor, and they lead with that. And they rightly so, deserve and got their training to be able to be titled as that. Back to the nursing again, it's a terminal practice focused degree, and it prepares them for advanced practice, leadership, and administration. Okay. They can still, in some settings, diagnose and prescribe, and depending on state laws, do this without a physician. This is where the scope of practice sometimes get blurred, and you'll look from many organizations that are physician-based where there can be problems arising, especially when there's malpractice, right, or an issue, and you have a doctorate of nursing. Also, there are more schools. Remember I told you before everything got formalized with medical training? There are now schools popping up doctorates of nursing or nurse practitioners that are not well-trained and mistakes are being made. This is another problem that happens why things need to be standardized and we can't skip things. I now am going to talk about something that confuses us even more than what we talked about. Yes. And this is when we get to the gray zone, the shades of gray, should I say. And that's these honorary degrees. Now, I love Usher. There are several musicians. There are even some prominent people in education that are out in the limelight doing many things, and they have received honorary degrees. Okay, so honorary degrees now puts us into a different realm. These were awarded from maybe that's an institution they went to school for some time. They're awarded for achievements. They're not earned academic or clinical training, and they're not valid for use in clinical and academic settings, okay? They're not valid. So they can take that honorary doctorate, and I know many that get it and they do not proclaim to be a doctor, but they know they're not used in clinical academic settings. And that's very important because we're seeing this a lot. We do say, and many people do say, that they know they don't really confer the right to use doctor professionally. They do not use it professionally. They can say online, I just received my honorary doctorate. That's great, yada, yada. But like Oprah does not use Dr. Oprah. She goes by Oprah. Well, that's also her trademark is Oprah. There now are, what do we call them? Degree mills. These are really problematic that we have degree mills that are online and unaccredited, okay? So if you get a doctorate from an unaccredited institution, it's null and void. I don't even think you should spend the time and money to do that when you get something from a place that's not accredited. These are universities. Columbia Pacific University is one. They actually shut down in 2000 because they had a lack of accreditation. There was Rocheville. I don't know if people remember Rocheville University as well. It was a degree for sale model. It was not accredited. You pay, you get your degree. There actually is a fake one online, and it was called a honorary doctorate in Dudism. And the interesting thing about this is that I met somebody on social audio that went online to get that degree, which they said it was fictitious, and they said this is all satire. And after that, on LinkedIn, and we all know LinkedIn is a very business-minded site for professionals, they now go by doctor on LinkedIn based on a fake honorary doctorate. I mean, it's honorary and it's a fake honorary doctorate. That's not even accredited. The University of Metaphysics and University of Sedona offer PhD in metaphysics. Now, that becomes very problematic because, as I mentioned before, online I'm seeing these doctors quote doctors selling herbal medicine to people online as a Dr. A, Dr. B, and they go to these metaphysical universities and get this degree that has no bearing. First of all, metaphysics has nothing to do with naturopathy, with treating someone with fibroids, but they use that term. So they just take doctor. I'm going to grab the term doctor and use it in any capacity I can to get some type of authority. That's what this is truly about. It's about wanting to get authority in a shortcut way without the work of it. and to be honest, without the responsibility of what it really entails, to be honest. Because when you do it this back route, sometimes you don't have anything to lose, like doctors do that truly earned their degree. Hello, listeners. We want to remind you that you can catch The Medical Collective on all your favorite podcast platforms. That includes Apple, Spotify, and YouTube. Be sure to hit that subscribe button so that you never miss an episode. We're also on Libsyn, and you can find us on all social media platforms as The Medical Collective. Do you have thoughts or questions? Please don't hesitate to reach out. We love hearing from you. Now let's get back to the conversation. I will say some red flags that you can look for. Life experience credits instead of coursework if you go to it. There is no recognized accreditation, and get your degree in weeks to months. Why do we need to shortcut our education? Why? It should be a definite red flag. The implication and the problem is that people can use doctor on social media for wellness coaching, and it misleads the public. And at the end of the day, it's the public that is harmed by this. In healthcare, if you misuse, it borders on fraudulent misrepresentation. And especially if what we saw recently on TV by someone that's not a doctor but holds a position, you cannot give medical advice if you're not a physician. And physicians don't give medical advice to someone that does not have that is not their patient as well. We give information, and we always put that disclaimer, but we don't give medical advice to them. That can be a problem. So I just want you all to understand that, to be aware of that as you navigate. What is it? You navigate these social media streets are very, very dangerous. You go to your doctor's office, you can look on their wall, right? And you see their plaques, tons of degrees we have, and our fellow degrees, our degrees for the societies we're part of, the license we have. So after we get our degree, doctors are different because we can get first of all, when we finish medical school, we get our medical degree. This also you need to be aware of. There are many people that finish medical school and never go to get a specialty training. And in the United States, you will not be able to practice because you have not specialized in anything. Medical school was 2 years of didactics and 2 years of shadowing or being in the hospital, but not having the same weight of responsibility as a resident. When you go into specialty training, you're specializing. So I have seen a lot of people now this is another thing. Technically, they're a doctor. They finished medical school, but they never got into residency or finished it. And actually, the current to be Surgeon General, Casey Means, she didn't complete a residency. Yeah, she did not complete a residency. So she went to medical school, but she's never been able to practice because she didn't complete a residency. So she's not boarded in any specialty. That's what we call it. When you finish your residency, you get boarded, and you have to take an exam, and then you get boarded. In order to get a job anywhere, they're going to want you to be board certified or at least complete it within a certain number of years. Then you have to be able to, in each state that you be able to have a license to practice in that state. And these are all things you can look for. So if someone says they're a medical doctor, ask them what their NPI number is. NPI. That is an identification number that physicians get, that nurses get, and you can track them. And through that, you can actually find out where they're board certified instead of going to look at the state, at the medical board or whatever their board is, pathology boards, what have you. And it kind of gets away from having to go look at what states they're licensed, their NPI number. And there is a way you can do NPI lookup. And I'll put that in the show notes for you to help you so you don't get confused on it, the NPI number. So that's how you can look up physicians. And I implore you do look them up. You can look up to see if they have been, anything has been reported against them, any lawsuits they have. And I believe that you have the right. Someone's putting hands on you, or you're getting information from them, or you're trusting them even online. You need to know who you're talking about. And I please implore you, because they are good. The fake doctorates are so good at it. We even sometimes, there's been a few of us doctors that have been following doctors and we all mutually follow them. That's another thing. Don't look because one of us follows a doctor sometimes, unless we're actually tagging them, that we may actually know who they are. And some of these doctors are really good at it until I look and it's like a circle. You can't actually find out where they are. Again, you don't know what they're specialized in, or they have like 20 specialties and they're like 30 years old, which is impossible. Again, I've seen someone that they took a CV off of a colleague and copy and pasted it and then added a whole bunch. So they were a surgeon, internal medicine, nephrologist, radiologist, maybe even a pathologist. They had like 7 specialties. Now, I have a triple board certification, but I explain how we get that, but it just didn't add up and there's no way. So that's another red flag too, is to look at the number of certifications that a physician is saying to make sure that they are who they say they are. Okay, there we go. Now, this confusion, why I really wanted to do this podcast is because this confusion can lead to danger. It leads to public mistrust, and it hinges upon patient safety. Patients rely on Dr. X for authority, as we've even seen, or someone that's not a doctor that's now taking the authority and giving medical advice, as we've seen, or saying what you can and can't take. And that spreads faster with a title. It comes into now influencer versus expert. People online love to see influencers. If they've got thousands of followers, they trust them more than maybe a physician that is so busy working. And I remember when I first started on social media, I didn't have many followers. And that meant more than actually my degrees and my practice and experience. So that can be dangerous. There was a TikTok naturopath that was saying cancer isn't real and you shouldn't cut it out surgically. I was concerned. My co-host, Dr. Sharon Smith, had also brought it up to me, and many doctors actually responded to it because they're like, "You're confusing people in a time of already a lot of anxiety and stress when you're getting diagnosed with cancer, and now you're being told it's not real, it's meant to be there, leave it in." That can change your whole outcome of disease based on that. So that's very dangerous. And this person has hundreds of thousands of followers. Hundreds of thousands compared to my little couple of thousand of followers. Yes. In 2021, Pew Research reported 64% of Americans said they had trouble distinguishing credible from false medical advice online. 64%. That's more than half. And the American Medical Association repeatedly warned about the dangers of misused medical titles. So important. So we've been trying to warn about this, to talk about it, and we will see where it goes. In California, it is illegal for anyone to use doctor in a clinical setting unless they specify their degree type. I love that. Now, you hear that in a clinical setting. So social media is not considered a clinical setting, so they get away with it. In Texas, the Texas Medical Board has fined alternative practitioners for using doctor without disclosing they were not an MD or DO. And in New York, they require healthcare providers who are not physicians to verbally clarify their role when using doctor with patients. So at the state level, states are going to have to crack down on it. But my concern, again, is what are we going to do on social media? So I hope that this podcast, we flood it, we share it so that people can understand this. Because regulations do vary by state and country. And when it comes to social media, there's no requirement for clarity. Here's some real-world legal cases. In Florida, in 2019, there was a woman calling herself Dr. Love. I don't know if people remember that. She was arrested for practicing medicine without a license after posing as a physician, and she had a fake clinic. We also do remember about the doctor in Florida that continued to practice even after getting in trouble again and never had a license as well. Had a whole clinic full of patients. In Canada in 2021, there was a naturopath in British Columbia, and she was fined for using Doctor Online without clarifying her role. So they fined her online. That's great. Regulators cited the public confusion. I love that. Early 2000s, kind of late 1999s, there was a case, the United States versus Hulda Clark. This was a PhD naturopath. Now that you have learned everything, now does that make sense? A PhD in naturopath. There's not a PhD in naturopathy. She marketed herself as doctor and sold unproven cancer cures. Her clinic was shut down and she was investigated for fraudulent health claims. Wow. Also, we talked about the honorary, unaccredited misuse for the doctorates. Using an honorary doctorate as it confers can be prosecuted under false advertising statutes. So you also have to know when to spot this. And if you see that someone you know or just someone could be harmed from it, you can reach out and you can speak up about it. You can speak up about it. Again, if they're saying they're purporting to be a doctor in a certain state, you can reach out to that state board to see where you can make this complaint as well. So it just all depends. There were several wellness influencers with an honorary doctorate in naturopathy. Here we go again. So they take naturopathy, which actually there are some naturopath schools here. Not all naturopaths can actually practice in all states or work in the hospitals, right? But this naturopath was calling herself an honorary doctor in naturopathy, just took that. And they were forced by the Federal Trade Commission to remove doctor from their marketing materials. So we can be our little sleuths. Now, I'll tell you, I don't want to compare it to roaches, but like to ants sometimes. It's not, once you start to uncover a couple, you guys are going to see so many, and don't get overwhelmed by it. Just do and be aware of what you can in this conversation. You really can't do more. I know the American Medical Association has stated that anyone that uses the title doctor in clinical settings has to provide full context of their degree. So if you ask somebody about their doctorate and they get defensive, that should be a red flag. And you have every right to ask them that. Because again, they should be able to state it. The American Psychological Association said psychologists with PhD or what is PsyD may use doctor but have to avoid implying medical licensure. And the nursing boards in some states like Arizona and Florida, nurse practitioners that have a DNP, this is what I was talking about, like the doctor online, the nurse online, they have to clarify their role when introducing themselves as doctor. They have to say, I am doctor of nursing. Not everybody is doing that. Not everybody is doing that. Okay? So I implore all of you guys, when you hear somebody with the title doctor, ask, what is your degree in? What do you have a doctorate in? Medical doctor, DO, both practicing physicians have the same abilities. Are you a PhD? What is your PhD in? And you don't have to be condescending. Oh, that's great. You're a doctor of nursing. Oh, that's great. But you know their limits. Oh, you have an honorary doctorate. Then it starts to get gray. And then you wonder and ask, are they practicing within their scope? And if you ever have a question, you can report it. It's okay. And also ask, is this advice evidence-based and supported by their training and licensure? If they're giving you advice. I truly believe once we have a doctor behind our name, we have responsibility whenever we go into a social media platform, that we now are representing something bigger than us. So I hope all this information helps you, doesn't overwhelm you, but it should concern you when people that you're trusting are not who they say they are, right? What do we call that? An imposter. So not everyone that uses the title doctor is trained to diagnose and treat patients. Context matters. The word doctor carries weight. And to be honest, it carries a big responsibility. So the next time you see a doctor online, ask them, a doctor of what? Recommend that they use, or recommend to your friends that they check as well and ask, what is this person a doctor in? Because without context, it carries a risk. I thank you all for listening in today. I'm sorry I had to be very frank with you, but this is a conversation that has been concerning me for a while, and we needed to have it. I do recommend that you listen to the episode Masks Do Work. We've been using them for years. And that ties into truth versus information, which is really part of this conversation. I will put resources in the show notes, and I thank you all for listening in today. Enjoy until next time. Thank you for tuning in to the Medical Collective. We hope today's episode has left you with valuable insights and a new perspective on healthcare. Don't forget, follow us on social media for more updates and behind-the-scenes content. I'm Dr. Keisha Davis, and it's been a pleasure to share this time with you. Stay healthy, stay informed, and we'll see you in the next episode, where medicine continues to meet real life. Please note that the content provided in the Medical Collective podcast, including text, graphics, images, and other material, is for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed on this podcast are solely those of the individual authors and guests and do not represent those of the Medical Collective, its staff, and any affiliated entities. The appearance of content on the podcast does not imply an endorsement. Neither the host, Dr. Keisha Davis, the co-host, or any guest of the podcast bear responsibility for the accuracy of the content provided or the use of information received through the podcast. Reliance on any information provided by the Medical Collective podcast, its employees, writers, or guests is solely at your own risk.